Hello, everybody. I'm a couple minutes early. Hope that's okay. Dr. Marissa Tenenbaum from West County Plastic Surgeons of Washington University. And today, my topic is nonsurgical rhinoplasty or liquid rhinoplasty or filler rhinoplasty. Um, and this is actually going to be relatively quick. I just kind of wanted to come on and give everybody a little bit of information about what it is and how to kind of evaluate your injector and whether or not you're a candidate. So, non surgical rhinoplasty obviously is the nose, basically is a technique that has really grown in popularity over the last several years. And it's using fillers or injection techniques that many of you are familiar with to help reshape the nose. So, as you all know from prior posts and things like that, fillers are a volume in a syringe of different things, the most common being a hyaluronic acid. There are several different brand names. We use all of them here at West County Plastic Surgeons. We generally use them to help reshape and fill and add volume, shape to the face. Well, we can do that to the nose as well. So, how do you know if you are a candidate? Well, that is a great question. And my advice, whenever we're talking about fillers or your face, I always say you need to go to somebody who is extremely experienced. I think with the nose, it's actually even a step further. So I would recommend that you have, if you are considering something like a non-surgical rhinoplasty or fillers to your nose, that you see somebody who actually is also very skilled and does a lot of surgical rhinoplasty. So that means a surgeon, board certified plastic surgeon, or a board certified facial plastic surgeon, ENT, who does surgical rhinoplasty. I think that's really important for two reasons. First, the evaluation of your nose. So, not everybody is going to be a candidate, or maybe you are a candidate to get some improvements, but it is not going to maybe give you the results you think it will. So, talking to somebody who also does surgical rhinoplasty to have an evaluation of your face and your nose, talk about your goals, so they can talk to you about the difference between, okay, you know what, maybe you're not a great candidate for this. Maybe you really need to consider a surgical rhinoplasty, and here are the differences. So, if you go to somebody who just does fillers and doesn't do rhinoplasty surgically, obviously that's not maybe something that they're going to be as well versed in. So I think that's the first important reason. The other really important reason is because I think that the anatomy of the nose and the whole face, but especially the nose, there are certain areas that are just riskier, and the nose is one of them. So going to an injector who understands surgical rhinoplasty, so they understand the surgical anatomy of the nose, the blood vessels, where the cartilages are versus the bone, et cetera, I think is really critical, not only to a good result, but also a really, really safe result. So that is the number one take-home message. The second thing I wanted to talk about is whether or not you're a candidate for something like this. There are a few things that go into that. So first is understanding that filler is injection of a liquid product to help reshape the nose. It's not going to make your nose permanently different, right? We're not permanently altering the anatomy. So if you want something that's going to permanently alter the anatomy, then you need to be considering surgical rhinoplasty. Filler cannot make the overall size of your nose smaller. So if you feel that your nose is too large, filler may not be a great option for you. That being said, it still may be useful to discuss that because sometimes patients may feel their nose is too large when in fact it really may be just that they have a bump. And if that bump were camouflaged, they may not feel that their nose was too large. So still something potentially to bring up. The best candidate, in my opinion, for somebody who is considering non-surgical rhinoplasty is somebody who wants to camouflage a dorsal hump. We can place fillers strategically around that hump to try to make this look smoother, straighter, softer. Okay, by building up areas around the bump, we can make the bump basically where you don't really see a bump anymore. It looks straight. Somebody who wants to have the tip of their nose maybe slightly more turned up or shaped, we can strategically use filler to help angle the nose more, make it look like it's more angled upward and kind of fill in. And the way we do that, frankly, is we are using the filler almost in a way that we would use cartilage grafting in the operating room, which means placing cartilage in strategic areas to shape the tip of the nose. So again, we can't use filler to make the tip of your nose smaller or your overall nose smaller. So in those situations, you're probably not going to be a great candidate. But if you're somebody who we can make some changes to the shape of the nose and that's going to be a bit more aesthetically pleasing, then you might be a great candidate for it. But remember, it's not permanent. So touch-ups kind of early on are not uncommon. So usually most of us, the way we want to do this safely is we're not going to put a tremendous amount of filler in somebody's nose. We want to do this really safely. So we may start out very conservatively and then want to see you back in a couple weeks to evaluate and maybe place a bit more filler strategically. And then as that filler starts to go away over time, which could be several months to a year, sometimes it can even be a few years depending on the filler you use and depending on the metabolism in your particular face. It may be something that you want to repeat over time. For some patients, it may be something that they just aren't sure about a surgical rhinoplasty, and then they decide after getting filler, you know what, I think I do want to just go ahead with surgery. You can do that. However, you want to make sure that your surgeon knows you've had filler. So if it's not the person who placed the filler, you want to make sure that you're really, really open and honest about that from a safety standpoint, as well as being able to effectively evaluate your nose. That filler, you either want to wait for that filler to all dissipate, or your surgeon will most likely want to dissolve the filler by injecting an agent that can dissolve a hyaluronic acid filler. And usually both. So if you were my patient, I would want to dissolve the filler, and then I would also still want to wait for a while and evaluate you to make sure that at least most of that was gone before we did surgical rhinoplasty. If you are not sure and you're interested in sending us photos, you can contact Christy in my office. You could even send her some photos to say, hey, does Dr. T think that I might be a candidate for this? And we'll let you know. It's always best to evaluate you in person, but we can often tell quite a bit through photographs. So I hope that this was helpful. Again, any questions, you can message them. You can do a private message if you want on either the Facebook, we're on Facebook now, or on Instagram, either one, and I will, one of us will get back to you. I think it's also important to know that often, whether it's with me or somebody else, another experienced rhinoplasty surgeon / injector, oftentimes the pricing for this is a little different than the pricing for fillers to the rest of the face. So be prepared for that as well. Rather than necessarily buying a certain number of syringes, it's usually more of a procedure cost because of the way that we do it and the way we treat the fillers. So again, I hope this was helpful, and I hope you all enjoy the rest of your Monday.